Welcome to AGD 2022, the premier meeting for general dentistry. Hello everyone, I'm Allison Godlove. I'd like to welcome you back for the final day of AGD 2022, live from Orlando, Florida. We are at the luxurious Rosen Shingle Creek Resort, right in the heart of Orlando. And right now, we are outside of a two-part series. We're outside of the lecture portion entitled Dental Sleep Medicine, the Search for a Reliable, Predictable Outcome to Achieve Maximum Medical Improvement. With me now is the speaker, Dr. John Kamisi. Thank you for talking with us.
Very nice to be with you. Good morning, Allison.
Yeah, it's great to see you this morning. So what are attendees going to get out of this lecture this morning?
Well, this arena of oral health, sleep, airway, sleep medicine, et cetera, is very important because a lot of the root cause of the disease that we see is emanating from people not being able to get effective sleep. And if you don't get good deep sleep every night, you don't get good REM sleep every night, your body goes haywire. Your brain is foggy all day long. You're not the nicest person in the world to be with all day long. And that's all because of ineffective sleep. Now, there are all kinds of things that are out there in the marketplace to try to help you sleep better, mattresses, pills, devices, et cetera, and so forth. But without understanding what the root cause of the problem is how effectively you are sleeping. If you're not sleeping well, you're waking up multiple times per night, which happens with people with sleep apnea, you are a mess, physiologically, mentally, et cetera. Your family suffers, you suffer, your work suffers. So being able to understand this important component of analysis and screening is what's going to help the dental profession move better and better, closer and closer to medicine, and helping medicine understand how to work better with dentistry.
It really is such an important topic.
Yes,
so someone who is attending this then, what are they going to be able to do right away when they leave this course?
Well, they're going to be able to identify people who may have this issue by doing effective screening, looking at the overall way that the tongue sits in the mouth. If it's too big, if there's scalloping, if there's all kinds of wear facets and basically wear and tear on the teeth, they're going to be able to say, there's something going on. And they're going to ask a simple question. Has anyone ever told you that you snore? Everybody's going to answer one way or the other. They don't give you a no. They say, yeah, my wife, my significant other, et cetera. The guys on the camping trip, they don't want to sleep with me. And once you ask them that, and then you ask them the second question, how many times do you get up at night to go to the bathroom? And they look at you like, how do you know that I get up in the middle of the night? Because if they have the signs and symptoms of any kind of sleep-related breathing disorder, there's always an issue. Their heart is running all night long. They're racing instead of resting. And their kidneys are functioning, their bladder is filled, so they've got to go to the bathroom. So this is an overall really pandemic circumstance, to use that horrible word that everybody's been using the last several words. But it's really insidious, and it happens to everybody. So by the end of today, people will be able to understand the signs and symptoms, be able to understand that we need to work with medical colleagues more effectively, especially our sleep physicians, to get people tested, to get people determined that they need treatment, and what types of treatment are going to help them.
That's the really great part about coming to AGD and being part of these scientific sessions. Yes. So what would you say to somebody about participating in future sessions or even coming to AGD 2023?
Well, AGD 2023 and every other AGD meeting is important because it's camaraderie. It's education. Being here, you are with your friends. It's unlike any other meeting that I go to typically. You know, I know some people at some meetings, but here I seem to know everybody. So being here, you learn things that you would never find anywhere else because you can get the hands-on component of the courses that we do. And you get the knowledge that is cutting edge in every way, shape, and form. So Nevada AGD 2023 should be awesome.
What does being an AGD member mean to you, and what has it done for your career?
The friendships that I have developed over the course of the time that I've been involved. I was trustee and Speaker of the House for the Academy until 2015, and it was wonderful. Got to meet them, and being here, seeing my colleagues, seeing my friends, the hugs, they're awesome. And again, this is the thing, everybody's a family at the AGD, so you certainly want to be a member. It's benefited me in my career. Now that I'm a professor at the Medical University of South Carolina, it brings my credentials there. The things that I learned, I share with my students, and we become better because of that experience. And I become better because of my students. So it's really an awesome situation.
Dr. Kamisi, thank you so much for spending some time to talk with us.
An absolute pleasure. Thank you. Have a great day.
Thank you. You as well. We appreciate it. We are joined now by Dr. Mark Arena. He is attending today's lecture series. Thanks for talking with us.
It's very welcome.
And how is it going so far here at
It's
AGD?
going great. It's been a fun week. I've been to a lot of great classes. I've learned a lot of new things, some things that, I needed to brush up on, and caught up with a lot of old friends, classmates, people I've been stationed with, people from all over the country and all over the world. It's been great.
Why was it important to come to AGD this year?
Well, primarily I needed the CE to maintain my license, but more so it was a matter of catching up with old friends.
And what are you looking forward to in this lecture today?
Sleep medicine is near and dear to me for personal reasons, but it's also becoming a growing part of my practice. Identifying a potentially not in and of itself life-threatening condition, but a condition that can significantly increase mortality and morbidity. And being able to identify that early is important for our patients.
For people watching this at home that didn't attend this year, why should they go to AGD 2023 in Vegas?
Well, as I said before, it's great CE. It's a great way to network and meet friends and learn new things. And Vegas has its charm.
Dr. Arena, thank you for spending some time to talk with us.
Thank you.
Enjoy the lecture series. Thank you for joining us here on AGD Facebook Live. We will be back in just a couple of hours at the new Dentist Lounge Plus for part 2 of this lecture series. Thanks for joining us. We'll see you in a little bit.